All right, let's get right into it. Today, we're tackling one of the most dangerous and, frankly, sneaky complications of pregnancy, HELLP syndrome. This is a condition that can go from feeling a little off to a full-blown medical emergency in just a matter of hours. And it does it all while hiding in plain sight. So let's unmask this great mimicker together.
So, let me start with a question for you. Imagine you're in your third trimester. You're feeling kind of crummy, tired, nauseous, maybe a headache. Your first thought would probably be, ugh, I'm catching the flu, or just chalk it up to being pregnant, right? But what if those exact symptoms were actually a huge red flag for a life-threatening emergency? Well, that's the dangerous game that HELLP syndrome plays.
So let's dig into why this syndrome is just so treacherous. It's all about its ability to look like something else, something far less serious. And that mimicry is what makes it so hard to catch early on, which is why it is so important for both patients and doctors to be aware of it.
Now, take a look at these symptoms. What really stands out is just how common they are. A staggering 90% of women report this vague feeling of malaise, just feeling off. And up to 90% get pain in their upper abdomen. You add nausea and headaches to that mix, and you can totally see why it's so easily brushed off as the flu, maybe a gallbladder issue, or even hepatitis. This is exactly why it gets that name, the Great Mimicker.
The key to really understanding what's going on under the surface of these vague symptoms is actually hidden right there in the name itself. HELP isn't just some random name. It's an acronym that was coined back in 1982. And it's basically a diagnostic map of a three-part attack that's happening inside the body. So let's break it down. We'll start with H, which stands for hemolysis. This is literally the breakdown and destruction of red blood cells. Just picture it. The tiniest blood vessels in the body become damaged and super narrow. So as red blood cells try to squeeze through, they're literally torn to shreds. It's a violent process, and it's one of the first big clues that something is seriously wrong system-wide.
Okay, next up, EL. This stands for elevated liver enzymes. So that same process that's wrecking blood vessels all over, it's happening in the liver too. You get these tiny blockages in the liver's blood supply, and that causes the liver cells to get injured and die off. When those cells break down, they release enzymes into the bloodstream, and that's exactly what a blood test will pick up. It's a direct signal that the liver is in distress.
And finally, we've got LP, which is for low platelets. Think of platelets as your body's first responders for any kind of bleeding. Well, with all this widespread damage to the blood vessels, platelets are being sent out everywhere to try and patch things up. But the damage is so extensive that the body's supply just gets completely used up. This leads to a dangerously low count, which seriously messes with the body's ability to stop bleeding at all.
So with all these confusing symptoms, how do doctors actually figure out what's going on? Well, it all comes down to the lab work. The blood tests are where that vague feeling of being unwell gets turned into cold, hard data, revealing this massive crisis that's unfolding across multiple body systems.
This table right here shows you exactly how they put the puzzle together. For hemolysis, they're looking for high levels of an enzyme called LDH. It leaks out of those destroyed red blood cells. They'll also look at the blood under a microscope for schistocytes, which are those telltale, fragmented, shredded-looking red blood cells. For the liver, an AST level over 70 is a huge red flag. And then a platelet count below 100,000 confirms the LP in HELLP. These numbers don't lie.
Okay, so we know what HELLP is, but the really big question is why? Why does this whole devastating chain reaction even start? Well, to get that, we have to rewind way back, weeks or even months before the first symptom ever shows up. This isn't something that just happens overnight. It's been brewing for a long time.
And here it is, the critical piece of the puzzle. The root cause of HELLP syndrome is the placenta. It all starts with the placenta's blood vessels not developing correctly way back in early pregnancy. That one problem sets the stage for the entire crisis. Everything else, the red blood cell destruction, the liver damage, the low platelets, it's all a downstream effect of a problem that starts right there.
This flowchart lays out the chain reaction perfectly. It all starts with a dysfunctional placenta. It's not getting enough oxygen, so it starts releasing these damaging substances into the mother's bloodstream. This causes widespread injury to the lining of all of her blood vessels. The body then tries to repair this damage by forming tiny clots everywhere, which uses up all the platelets. As red blood cells get sheared apart trying to pass these clots, you get the hemolysis. All of this chaos ultimately leads to massive liver damage. It's just a devastating domino effect.
So,
Once that diagnosis of HELLP is confirmed, it is a race against the clock. Managing this requires a fast, coordinated effort from a whole team of specialists: obstetrics, nursing, anesthesia, you name it. The number one goal is to get the mother stable and get ready for the one and only thing that can truly fix this.
From a medical standpoint, there are 4 top priorities. First, they'll give magnesium sulfate through an IV to prevent seizures, which is a really severe complication. Second, they'll use blood pressure medications to get dangerously high blood pressure under control and lower the risk of a stroke. Third, if the baby is premature, under 34 weeks, they give corticosteroids to help the baby's lungs mature super fast. And finally, blood or platelet transfusions might be needed to deal with the anemia and the serious risk of bleeding.
And right there on the front lines is the nursing team, providing constant moment-by-moment care. This means strict bed rest, usually having the patient lie on her left side to get as much blood flow to the baby as possible. They are continuously monitoring both mom and baby, watching for any sign that things are getting worse. They're also setting up seizure precautions, like padding the bed rails, and providing that absolutely crucial emotional support and education for a family that is going through something incredibly scary.
Now, to manage all of this, nurses don't just wing it. They have a strategy. They use what are called nursing care plans to proactively identify and manage the biggest risks and problems the patient is facing. It's all about making sure no stone is left unturned.
So, let's look at a couple of plans for things that could happen. First, there's the risk for maternal/fetal injury. Because that blood flow is so messed up, the baby is in a vulnerable spot. So, the key intervention is continuous fetal monitoring, watching like a hawk to catch any distress early. Then there's the risk for bleeding. With platelets so low, the body's clotting ability is shot. So nurses are constantly looking for any signs of bleeding, even tiny bruises or little red dots on the skin, and making sure blood products are ready to go at a moment's notice.
Now, what about the problems that are already happening? Acute pain is a big one. That upper abdominal pain comes from the liver swelling up and stretching. Nurses are assessing that pain constantly because how bad it is can actually be a sign of how severe the disease is. Then there's ineffective tissue perfusion, which gets to the whole problem. This means nurses are checking blood pressure and looking for neurological signs, like worsening headaches or vision changes, which could mean not enough blood is getting to vital organs like the brain.
All of these things, the medications, the constant monitoring, the detailed care plans, they're all designed to stabilize the situation, to buy some precious time. But they are not a cure. They're basically a bridge to the one and only definitive treatment for HELLP syndrome. And here is the absolute bottom line. The only way to stop this disease in its tracks is to deliver the baby and, crucially, the placenta. Since the placenta is the source of all the trouble, getting it out is the only way to shut down this whole destructive process and let the mother's body finally start to heal.
Now, the timing of that delivery is a massive decision. If the pregnancy is 34 weeks or more, the answer is clear: deliver immediately. Before 34 weeks, if, and it's a big if, both mom and baby are stable, doctors might try to wait a day or two to let those corticosteroids for the baby's lungs kick in. But it's a razor's edge. If either the mom or the baby starts to decline at any point, delivery becomes an emergency, no matter how early it is.
And the danger doesn't just magically disappear after birth. In a pretty significant number of cases, HELLP syndrome can actually get worse or even show up for the first time in the 2 or 3 days after delivery. This is why super close monitoring after birth is absolutely essential. The fight isn't really over until the mother's lab work starts to get back to normal and her symptoms are gone.
You know, surviving HELLP syndrome is just a massive physical and emotional journey. But for many women, it leaves this one big lingering question. What about next time? With a real risk of it happening again in a future pregnancy, understanding this great mimicker isn't just about getting through one crisis, it's about having the knowledge to navigate the future as safely as possible.